Yay, here we are. All right, it's March. This is my second monthly Fascia Focus Forum, just to talk to people who are interested in learning more, because I love talking about this stuff and I need to share. So thanks to you guys for showing up. And if you have any questions, two ways to let me know. I will be checking the chat, and I will also try to check the live chat on Facebook, perhaps, if it's going to show it to me. And if nobody has any questions to start, I have a little presentation that I just am going to share my screen with to kind of give some baseline that might help you if you don't know a lot about fascia. If you do know a lot, this will be just a review. And just because it's so important with what came up for me yesterday, and that's really what I wanted to talk about. And that was the significant headache that I felt coming on. I knew what it was all about. And I am no stranger to headaches. Trust me. It was, I at one point in my life had migraines so many days of the month that I was taking Maxalt or Imitrex, which are two pretty high-powered migraine medicines. If you're familiar with headaches, you're nodding your head and you know what I'm talking about. It is not, fun to have to take those things. So, what would happen is I would get, I'd feel it come on, and I would have to function. I was really doing a lot of important things at the time. I was teaching at the medical college. I was starting my own business. I was busy, and I had to function. And so, but everything that I was doing wasn't working, including those medications. And then you take those medications, and the next day you feel like, like a fog, like you're just, it's just really, really strange feeling. So yesterday I had one of those headaches, and I know where it came from, but I will talk about that in a moment. So right now I am going to go ahead and share my screen. And if I can get to the right thing here. Let me go to play. So this is just part of a presentation that I have used multiple times, and I'm just showing right now the just a couple of the slides, because I want to talk about the fascia as the connective tissue and what we understand about it now, because I realize that a lot of people don't understand this fully, and sometimes, as a practitioner, we kind of think that people know this stuff because we've known it for years, and we've been talking about it and teaching about it for years, and I've become aware that just because I've been talking about it and there's much more information out about it now, it doesn't mean that it's well known. So this will help to get you to see the whole picture as to what happened with me yesterday when I had this horrible headache. So what I have here is this word called, it's tensegrity is the word. And it started with can you guys unmute? Or can you not unmute, but can you mute? Just want to make sure, guys, I'm getting some feedback here. And for some reason, my screen isn't letting me do that. So great, thank you. So it was started by this architect, Buckminster Fuller, who, and then his kind of sidekick, sort of, Kenneth Snelson. He actually did this little model that you see on the screen here to the left, and it's using struts and cables. And so the idea is that it's a push-pull system. And like I say here, its forces are internally locked. The mechanical forces of compression, tension, push, and pull are invisible, and that it's pure energy in the same way that magnetic or electrical fields are invisible. So they were, building these structures back in the early 60s and using them in an architectural sense. However, and here's some examples of them, really cool structures. They are very strong, yet they're adaptable. And you'll see like these struts are very analogous to the bones in our bodies. And these little stretchy pieces in between are like the connective tissue. So I have a little model here, which is my own tensegrity structure, which I'll show once I stop sharing the screen, because I'm probably really tiny on your screen right now. But this is made out of rubber bands and wooden dowels. Okay, so this is an example of a tensegrity structure, and you can see how it's really like mobile and moves around. And if I change something in one part of the system, it changes the whole system. So that's really what I want to focus on here, and why I wanted to show you this, and why it's important about my headache. So bear with me. I often use the word scaffolding when I talk about fascia, especially with new patients, and I'm trying to explain. This is really too simplified, but I feel like everybody's kind of familiar with that term, scaffolding. And I found these pictures online. I thought, yeah, this kind of helps us to see. So when you think about scaffolding, it goes through the whole building, right? Like they put this scaffolding together and then they build everything within it and around it. So although scaffolding is very simplistic, not really like biotensegrity, you get the idea that it's like going through everything, because that's really what's happening with the fascia in our body. It is the body's scaffolding. And so we refer to this as biotensegrity, bio being body, tensegrity, the word that they were using in all of this architectural stuff. So here are some still pictures of fascia in the body, which were taken by a French hand surgeon, Dr. Guillaume Berthaud, who is just really shown so much light onto this world about 10 years ago. He put out a book and some videos, and I'm going to show you some of those videos to help you understand that we used to think fascia and connective tissue just went around parts of the body, but we know now that that's not the case. It actually goes through all the structures, through all the cells, and everything is dependent upon the state of it. So fascia and the bones, that's the biotensegrity, like I was saying, and that is actually my exact little model here that I have. So fascia is the tension network system within our body that is this biotensegrity struts and cables. And the cool thing about this is that knowing and understanding this, we can connect to the whole body in a completely different way. So we're not just looking at these little places in our body that hurt, we're looking at the whole thing. So here we are. I use this little fascia man a lot. In fact, I have the little paper right here. But what you can see here is the skeletal system and these little orange areas that are like restricted fascia pulling the skeleton into different shapes. So it's the skeleton, and all of the structures of the body's shape depends on the tension within the supporting structure, the fascia, the biotensegrity structure. So if these supporting structures change unevenly, we get imbalances. So if you look at this guy here, the skeleton, the right side is all crunched together. That orange is all pulling together, and you can see his pelvis is elevated. So that elevation, now we're just looking at it in a two-dimensional system, but it is also three-dimensional, right? So just kind of keep that in mind. We're balancing the tensions throughout the whole body and all of the connective tissue. So I'm going to play this. And it looks like I've got somebody in the chat here. Ooh, can't see the diagram. Well, I'll show you bigger in a moment here. Did you mean the diagram of the skeleton guy, Lulu? I'm just looking at your message here on the chat. Are you guys able to see the video at least right now? I'm going to hit this. Robin, I can see you. Can you give me a thumbs up?
Sliding underneath the fascial sleeve. It looks like saran wrap. It shares a blood supply, and without restriction, it slides easily. Then what we're seeing is the fascia pulled up from the tendon, magnified 25 times. Now we can see the little individual fibers binding together to form restriction in big tree trunks rather than each individual fiber. And it will only come apart with sustained traction, as you see in this example. This one little string comes apart from the rest. The whole system is very fluid filled and quite well hydrated in its healthy state. But you can see how it binds together and creates restriction. In the center of the screen, you'll see fascial release. And then off to the left, another piece comes up, and in the background, the whole fascial plane starts to let go. It's like a tectonic plate. And there's elongation of one of the fibers. This is an example of how the vascular system is buried in the fat and fascia. And when the fascia clamps in, in the dear God, we're going to die response. The purpose is to inhibit and squeeze these blood vessels so that if you get cut, you don't bleed too much. It squeezes your nerves so that if you get hurt, you don't feel it right away. You can see how beautiful these little fibers are when they're individualized and how they're fluid filled. See the water flowing up the tubule? These are fiber optics that conduct consciousness throughout your body, sharing information about proprioception. It's a beautiful thing.
Okay, so I could watch that like hundreds of times. I just think it's so cool. But if you've never seen living fascia, that is just a great example of how everything is intertwined. And I love how she says there, she points out the fluid in the tubules. Fascia is like a straw in nature. And what's flowing through there is a liquid crystal. And that liquid crystal is what they're referring to as our consciousness. Like it's where our memories, our emotions, and all of that is held. And it's an instantaneous, like the fiber optics, an instantaneous communication system through all the cells actually is much, much faster than the brain. So, and the nervous system of the brain. So this is like working together with the nervous system in the brain, but connecting to every cell in the body. It's just fascinating. So John Barnes, my mentor for this work, has used this saying, and I love this. I say it probably at least once every day: find the symptom, look elsewhere for the cause. So I woke up with a severe headache yesterday. What I'm constantly thinking about is, and feeling is, where is it coming from? So this is my little different take on the fascia man here, because I've got, a couple of different, I took the fascia man on the right and flipped him. So sometimes people have all that restriction on the left. Sometimes it's on the right. It can be anywhere. So as many people as there are in the world, there's that many different fascial restriction patterns. I mean, everybody has a different story. So if you fell when you were 2 down the steps, your body adapted to that. Most of the time you get up and you're okay, right? You shake it off. Well, there's a pattern that's starting to happen when you have a trauma or an injury of any kind. And so we might not notice it, but over the years, things build up. So, this person on the left here is an example of, these red areas, really restricted fascia. And so when I'm working on a patient, I will often grab both ankles just to feel up into the body. And I can actually feel with my feeling sense, like this red area on this person. You can feel all the way up. It's very, I love using this example of a tablecloth on a table. And if there's a stack of plates in the far right corner of that table, on top of the tablecloth, if you were tapping on the table or pulling on the tablecloth, you'd be able to feel where that is. You follow me? You'd probably even be able to feel if it was a super heavy box compared to a stack of plates, because that tension would feel different on the cloth. When I'm pulling on the body, I can kind of sense that. I can sense where these restricted areas are. So when I woke, I knew I hadn't been doing the self-treatment that I would like to be able to do the last week or so. And it really, it got me when I woke up yesterday morning. So here's the thing, my head was in pain, right? But fascia doesn't stop there. The fascia, it wasn't just here where it was stuck. It was everywhere. And this is, oh yeah, let me show you this little thing. So this is an example. I love this example of the shoulder, because the whole shoulder girdle, the whole complex has to work together. We have 4 joints that help us get our arm up here, okay? So imagine if this area where I have the red there or around the shoulder blade was all stuck with fascial restriction. This movement, which you're going to see over here in a moment, watch this shoulder move. See how that moves? The shoulder blade moves. It should be able to do that. If it's stuck real heavy over there next to the spine by the shoulder blade, it's not going to be able to move well. And we see this all the time. And what that does is create a lot of strain on the glenohumeral joint, the joint that we think of as our shoulder joint, but it's because it was stuck, right, along the shoulder blade. So that just gives you a little idea. Oh, this is a fun thing to see. So what happens to fascia? On the left, there's a very extensive straight jacket, right? It's from neck to feet, straight jacket. And then that's how a lot of people feel sometimes, right? But over here on the right, I love watching this image and just how we should be able to move very freely like this. And when we start to get hung up, I feel like restricted fascia is like a straitjacket. And then we're not able to move like this. And so our body has to adapt, and something has to give. Something has to, not move quite right when that happens. So it's almost done. There we go. So ideally, we want our bodies to be more like Jell-O and less like concrete, So when we get that restricted feeling or that restricted fascia, our body becomes really more like concrete. So, okay, I think I will stop sharing my screen if it will let me. Uh-oh. Do I still have you guys? I do. Yay. Okay. So I hope you guys enjoyed that. It gives a little review for some of you, but just okay, this is what we're talking about. So here's my fascia man for anybody who didn't see it. All right. So when I woke up with this bad headache, which was very reminiscent of what I lived with for about 2 years and about 1.5 years of taking big time drugs, I wasn't just feeling it in my head. I could tell my whole body. I mean, I could have colored this whole thing red because I had been really tense for several days. And there are a number of techniques that I use myself and I give my patients for regular self-treatment. And let me get out of here again. Okay, just checking the chat. What I knew that I needed yesterday was the hip strap series. And what I do is I use my yoga strap, which I will show you. And I do a whole series where I use this on my foot, and I'm doing very specific things with my arms and lengthening my body and getting my whole body into this routine. And where it first came from was teaching yoga almost 25 years ago now. I took yoga instructor training. It was like a 15-day, 24/7 event. And from, even prior to then, when I was taking yoga, I was really drawn to stretches. If you've done yoga, they use the strap a lot. They do it on their feet. The leg goes up, that whole thing. That's kind of where it came from for me. But over the years, I've adapted it and made it more of a myofascial technique to treat. And when we do work on the fascia with this tensegrity structure, what it responds to is elongation and compression. Because when you see this whole model, right? When I compress it, look how it changes. So it changes the structure. And when I stretch it or elongate it, it changes it also. So we can actually use our muscles and our position to create an elongation or a compression. And we can use tools, but we need to be gentle. So we never want to force the structure because it's not going to give. It's not going to let go. It's not going to change shape. And it needs time. And this is the difference with the John Barnes method, is that we recognize that need to hold things for a really long time. 2 things that happen with that, well, more than 2, but 2 key things, is that the collagen portion of the fascia, there's elastin and there's collagen. The collagen needs that time to change shape. Otherwise, it's not going to change. It's just not there long enough. And if we want to make a difference in all of these colored areas, we need to stay long enough and we need to be comfortable in that position, or the body is not going to let go because it's protecting us, So in this series, I got thinking about it. I woke up, I'm like, oh man, I can't remember the last time I did hip straps series. And I know that's not good for me because I know from past experience that I need to do it like 3 times a week minimum. And 2 of those times have to be really good, not just a quick 5 minutes, And so, okay, I knew I would start with that. And so as soon as I could, it wasn't until last night. So my headache went on all through the day, pretty significant. And I finally got to lie down on the floor and do this series. And I spent a good amount of time really connecting into my body and feeling what was going on and allowing my body to change. So I talk about this calm technique that I use. I came up with this acronym just because in trying to find ways to help my patients learn how to figure out what their body needs. Like when you wake up with a headache, what do most people do? They run to the cabinet, right? Like, let's pop this pill or that pill, or we might have a few things to try. But I knew that none of those things were going to help because it was structural. I could feel everything pulling down on my body and compressing in my head. A lot of times people will complain about this, upper trap tension, and it goes up into the back of the neck and into the head. Well, I had all that going on and then some. And even my vision was getting affected, and you start to feel almost sick. Like a lot of people will get nauseous. I used to get a lot of nausea with my migraines because the vagus nerve, which controls the gut, was compressed. It's like stepping on a garden hose and the water's not coming out. Well, the fascia is compressing on a neurovascular bundle that controls the stomach and the gut, and it's not happy. So you feel sick, So anyway, I went ahead and did this whole series. And while I'm doing it, I'm making sure I'm lengthening. And then it was pulling into something else. And then it was pulling into this thing over here. Now I got the other side going. And it was like being stretched from all the corners of my body while I'm also connected. So the calm technique is to connect with my body, right? I was having to really focus on being present and feeling. And, I wasn't either. I also wasn't upset about any of this. I'm watching my emotional state because that's all connected to this too, right? I know now that I'm going to be okay. I know what I need to do. And so I was very calm. So I'm connected and I'm assessing this whole time. All day long, I was assessing because I could feel it. But as I'm doing this lengthening using this strap, I'm assessing my body and I can feel areas that maybe need a little more tension, or maybe I need to ease up over here. And I'm listening to that. That's the L. I'm listening to how my body was changing. And I'm breathing slowly and letting go with my breath, feeling into my body. And then the M in the calm technique stands for move. So sometimes move, and I joke about this, but sometimes move means get off of the couch, get on the floor and start doing something for your body, right? Or sometimes it's allow the body to maybe unwind or to lengthen or to shift or to change, which I had a lot of that going on. It took a while for that to happen for me last night because I was so tense, but as I continued to breathe into things and wait, I could actually feel my pelvis moving. And as my pelvis was moving and changing, my hip was changing, and then my shoulder blade and my spine, and I could feel my neck. And then suddenly I could feel my neck pop because as that tissue is releasing, it's changing where the structure is, right? So I moved through all of that. After that, I could still really, I had a lot to still do. Then I used the strap again to wrap around my knees and around my shoulder girdle. So it opens up into the upper trap here. And then I did that on both sides, and I stayed there for quite a while. And then I did a few more twisting motions, things that I don't even have pictures of because I was just feeling into my body like an animal that gets up from a nap. You watch them. They'll kind of do all kinds of things and move around, and we sometimes refer to that as promoting and unwinding and kind of feeling into the body, seeing what it needs. So I did quite a bit of that for a while. Then I got up and helped my mom because she had come over to help me in the kitchen. I did some of that, and then as soon as she was gone, I went right back at it and I started really working on my head. And this is where I made some significant changes to the actual head because my body was feeling better and my headache was changing. But what I did is I put my hands on my head and I just held it, first of all. And, settling in and connecting with our bodies. How often do we do this? Just holding my head. Now, last year, I had the accident, crashed my face on the ground. And I learned a lot about treating my head, and it was powerful. But when you hold your whole head, my fingers are on my head, my palms are here, and I'm just gently holding. I'm not compressing together really tight, but I am compressing together a little bit. And I just stayed here. And within a few minutes, I could really start to feel things shift inside and loosen and change. It's just amazing. Once you quiet yourself down, what you can feel. So how did I do this for such a long time? I was sitting on my at my island on my bar stool with my elbows on the island and just resting there. So I was very, very comfortable, and I was able to do it for a long time. I have no idea how long I was there. I was there at least 5 minutes on that. I mean, all of these techniques, I was at least 5 minutes. So I was working on myself a couple hours last night. So I went through all of that. Then I just felt like I wanted to take my hands to my eye sockets and kind of push here on the cheekbones, you know, and then I took my knuckles here and pressed like where my eyebrows are. And I started like this, and then I opened them. So it was so cool because I was able to open my eye sockets and just give enough compression and stay there for a very long time. And after a while, I could actually feel my hands shift like this because they were following the bones. And if we stay long enough and we're connected and feel, you will get a change, you know? And it just, I could feel the relief deep in my eyes. If you have headaches, you know what I mean? Like it's way back in there. And it just started to let go. And I was like, it was amazing. So all of this was feeling better. And then I went into my mouth. So I took my thumbs right into the roof of my mouth on either side. There's a line right down the middle of your palate there. I had my elbows on the table and I was compressing up and outward for a very long time. And at the same time, I used my fingers up here wherever it felt good. I actually took them to the eyebrows. So I had my thumbs in my mouth and my fingers here. And I just waited. And here's the hard part, you know, is having patience. And people ask me all the time, how do you do this? Like, how can you do this work? Like, isn't it boring? Well, once you start to feel in your body and improve your sensitivity to this, there's a lot of stuff happening. So it's not boring at all. And when you're doing it to yourself, it feels so good. Like the release starts to happen, the shift starts to happen. And it is literally like taking your foot off the garden hose. You know, it's like being compressed. Remember that picture of the straitjacket, just that compression? It's like someone coming and undoing all of those buckles because now there's space, you know? So I've rambled a lot and I've got a chat thing here. So let me look at this. Yes, it's being patient, right? But the way I would answer that, like how do we get past that part? I mean, it took years of practice for that, probably for me. When I first started doing this work, I was really stuck on watching the clock because it's important to make sure you're there long enough. Time is weird. Like when you start doing this, it's like, okay, am I here 30 seconds or is it 3 minutes? And sometimes you get so lost in the body that I still notice the clock because I want to make sure that I'm, you know, it's not been longer or less time than I would like. And oftentimes I mean, it's not unusual for me to spend 15 minutes in one spot if I feel things happening and things are about to move. So, you know, you learn to feel inside and notice the change, and you just keep coming back to it. Just keep coming back to the breath. And once you start getting some shifts and feeling the difference, it's encouraging and it teaches you how to be there longer, basically. So, okay, I've been rambling. Does anybody have a question that they would like to unmute themselves and ask? Nobody yet. I'm not done with my self-treatment that I did last night either, by the way. I did all this head stuff. So after that, I did legs up the wall. I actually ended up falling asleep in legs up the wall. I don't have any idea actually how long I was there, but I was connected in, and it was amazing how tight my legs are. So if you've watched my videos about legs up the wall or been to any of my classes, I talk about how important it is. The goal is not to get to the wall, you guys. It's not at all the goal. The goal is to feel comfortable at the wall wherever you are, right? You might be right next to the wall, or you might be 18 inches away from the wall. It's okay. You just don't want your knees to be bent and in pain because it's too tight, right? Well, last night I get to the wall and my knees are bent. That's how tight I had gotten in like a week of not doing the hip strap series. So I'd been doing legs up the wall, but I had gone a couple of days without doing it. And I was shocked. So I had to move myself away from the wall last night and wait for my legs to kind of lengthen and take their time. And Then I did the wide position in all the positions that I do, right? And then I ended up taking my hands to my legs and helping them while they were in that position. And wow, like to be able to feel that pull up into my sacrum and my tailbone. So here's a tip that a lot of people don't know. If you've ever had tailbone trauma, or you fall on your butt, or you hit your really low back, the sacrum area, that is very much connected to the head. So when we take these courses, we learn about how to treat these areas and to check the pelvis, make sure everything, because then again, there's our find the symptom, look elsewhere for the cause, you know? And tailbone trauma can create an instant headache. I actually had that happen before too. So this was, I don't know how long ago, like 20 years ago, because I had the therapy group, my first clinic. And I remember I was on the phone at my house, and I was sitting in one of those funky computer chairs that has like you kneel in them, you know, and I did a quick turn while I'm on the phone, and I fell backwards off that chair right on my tailbone on the hardwood floor. And I had an instant headache. It was actually kind of cool to experience it, you know, in retrospect, because I could feel that right away. It was like somebody hit me in the head. I didn't even hit my head on the floor. I hit my tailbone on the floor. And when I got up, oh, horrible pain in my head. And so luckily I had a therapist that was working with me at the time that was able to treat my tailbone that day. And it was like, after that treatment, I was 80% better, but I still had like 20% of my headache. Worked on it again the next day and it was gone. And I thought to myself, wow, like if someone didn't know that the tailbone was connected to the head in this way, how long would they go before getting that taken care of? I mean, maybe they wouldn't. Maybe it would be years. Maybe the body would start to adapt and create another tension to help release that, which is often what happens, you know? The body has a trauma, the fascia responds, it's getting restricted in one place, and maybe then it tries to adapt to create less pain in that area. Now you've got a couple of areas that are kind of layering into this whole situation, and then it goes on and on and on over decades, right? Well, for me, it was over like a week and a half of not doing quite the type of treatment that I needed. Okay, I have a question. Yay, a question. Let's see. Okay, so it's okay. The question is, I wish I felt that release. I feel better afterwards, so I know it's happening, but I don't actually feel the release while I'm doing it. And you know what? That will come with time. It's very common to feel that way. Even therapists sometimes feel that way when they're learning this work. It's like, oh, you know, your sense of touch and your sense of internal body awareness just improves with practice. It's unfortunately not always something that, you know, it's not like turning on a light switch. It's just there, you know. Some people have that, but, you know, for most people, that's not what it's like. It's just a gradual improvement over time. And how long do you do hair pulls? And can you show me? Yes, I will do some hair pulls here. And what are hair pulls? I'll show you that. One more question. Do you have any self-treatment for people who clench at night? I've had migraines for 10 years and I'm trying to find relief through yoga, chiropractic, and massage. Oh, I'm sorry. I feel for you. Yes, I clenched at night as well. I had a mouth guard for over 20 years, really. I don't feel that I clench so much anymore. I could have been clenching last night, but I kind of felt the headache coming on before bed. So I know it was the lack of self-treatment that I had that week. Hair pulls will really help for the migraines you've had for 10 years, by the way. So a hair pull is basically using the hair as a handle to get into the fascia at the top of the head. So remember, the fascia isn't just here. It doesn't stop here. It's everything. So when we touch the body, we're treating that whole body. Even if we're just touching up here, I'm treating all the way to the foot. And I've even had patients say, you know, I grab their head, like, oh, I always let people know, tell me if you feel it in your body. And they've actually said, oh, I feel that in my right foot. I feel that in my knee. I'm just on their head. Okay. So a hair pull, you're using your hair and you get your fingers in there. For those of you who don't have long hair, sorry, you can skip this part.
What about Annie?
There's what I do is put my hands somewhere, my elbows somewhere, like here. This would be a really good position. And I'm clenching and just tightening. You got to make sure you don't have like a one little hair that hurts, right? So it's all kind of uniform. And you're pulling out.
Can't grab any.
Yeah, Damien, you're not going to be able to do this one. Sorry. So I'm pulling outward, but you can also twist. Try twisting both ways, or maybe shifting one side up and one side down. Try different directions, because remember that tensegrity structure, it's going everywhere. So you're testing it. You're grabbing, and then do this assessment, right? CALM, calm technique. And like, I actually can feel the right side of my head is tighter. And so now I'm going to go forward. So I'm going to be pulling up with it. You can also do this when you're in legs up the wall. And you know what, Damien, what you can do, I mean, for people who don't have much hair or any, you can put your hands directly on the skin. Actually, if your hand is on the skin, it's not going to slide as much as it does on the hair, So you can actually compress and move your hand up so that you're not sliding on the skin, but you're just holding it there. And try different directions and see what feels good. I can even just compress there myself without pulling the hair. So it's different. There's compression and elongation, right? You can do either one. So another fun thing to do when you're in legs up the wall is, if you have the mobility in your shoulders, is to bring your hands behind your head, grab the hair back here, and pull away from your tailbone, away from the wall, if you're doing legs up the wall. And that feels really, really, really good to pull away. Actually, I did a post on this, I don't know, probably a couple of years ago now. I was doing legs up the wall, but I had the wide position, and I was at the sofa because, I hear this a lot of times too. People don't have a wall. There's so many places you can make a wall. So I don't buy that. If you don't have a place to do legs up the wall, talk to me, because I'll help you find one. But you can do the hair pull in conjunction with other positions. Even being on the foam roller too, you can do a hair pull. So let me see if I fully answered that question, if I can find my glasses. Okay, for clenching. The most important thing, I mean, you might not be able to stop yourself in the middle of the night from clenching, but what you can do first thing in the morning is treat it. So after, last summer when I had the bike accident, and if you haven't heard that video or podcast, I recommend it, because it was kind of amazing. It still is, to me, amazing. But my jaw was totally shifted off, right? And as soon as I hit the ground, my front tooth on the right side and all the teeth in this bone, right? Because you got that line right down the roof of your mouth. That maxilla is the bone. It was shifted over. So my right front tooth was behind my left front tooth and inside, and all those teeth were. And so that bone, and that's connected to the jaw, I couldn't open my mouth. So the first thing I did, and laying there on the ground, I did this to my jaw and loosened it just enough so that I could open my mouth, because I couldn't open my mouth. Then I opened my mouth, got my fingers in there, and started working, and I was able to fix it and the whole thing. But every morning for about 6 weeks, maybe more actually, I had to do this technique. So you feel your cheekbones, and I take the tips of my fingers and I go just under the cheekbone, and it feels kind of soft right there. Still firm right next to the bone. I'm going in and down, like that's the direction, in and down. So you find it, and it doesn't look like you're doing anything, but it's pretty powerful. You push in and down, and the key is to just hold it and be consistent. And you settle in and you wait. And I agree, that is the hard part, is waiting, and not letting go. So here's the thing. See how I am not moving? I mean, my mouth is moving because I'm talking, but my fingers are not changing. If I go like this, if I let go and I reposition, I got to start over. It's like starting over, you know?
It's good right there.
Yeah. Because you've let go and now the timer has to kind of start again, you know? So you're holding and you're waiting. And actually, I mean, this still feels kind of tight. I mean, I did do this one last night too. And you can do one side if you need to. In fact, I just told somebody today, they were really, really tight on this, on the right side. Like you can do just one side, because I would often do just the left side. So it was interesting. It was my right side that was compressed in with the accident. But, you know, when you think about it, the jaw, so you're clenching all night. It's a bilateral joint on both sides, the only bilateral joint in the body. So when something's going on over here, it's going to affect over here. So oftentimes, if you have tightness on one side, you have pain on the other, but you might have pain on the side that there's tightness too, especially in the jaw. I've seen so many TMJ issues over the years that it's like 50-50. You don't know which one's going to be more. So you can actually go inside the mouth also to treat this. But here's the fingertips, and this is what I would do every morning, just because I wake up in the morning and I wouldn't be able to open my mouth. I'd be able to open it like one finger width. This would be it. And that's not enough, right? So I would take about 10 minutes in this position until my jaw finally let go and I was able to open it 2 or 3 fingers. And I had to do that before I started my day, because if I didn't, I mean, that would be, I never would have gotten through all of that without treating myself consistently every single day, multiple times a day for the first month, especially. And then really the first couple months. I mean, I'm still treating stuff from that, but not near like I was. You know, this is the first time I've had a headache like that since last summer when I was dealing with a lot of this trouble. So that would be one thing I would do for clenching at night. And then you can go back into your cheek with your finger. How's our time here? So I always like to do it on the same side. Some people turn their finger and go on the opposite side. But way back here, there's a muscle called the lateral pterygoid. Now, I mentioned the muscle, but remember, the muscle is completely dependent on the fascia because all of those fibers are within that fascial biotensegral network, right? So I'm really treating the fascia that's holding the lateral pterygoid fibers. So I'm bringing my finger in here all the way back. That's what it looks like. I'm next to my tooth, okay? And my fingernail is next to the gum of my furthest back tooth and the tooth itself. And then the pad of my finger is going out towards my cheek. But for most people who are tight here, it feels like you're hitting a bone. It feels like you're literally going between 2 bones, but this one out here is not a bone. It is like concrete, right? It should be like Jell-O, not like concrete. But if you put your finger way back there in that cave, and you just hold it, you just keep it there, and you're kind of pressing back and out a little bit, and you can relax your bottom jaw, you know, so you're not opening it and stretching it, and you wait long enough, you'll get a release. Now, for some people, it's very tender. When you do it to yourself, it's actually less tender. When I'm doing this with this gloved finger on a patient, sometimes it can be extremely painful for them. When I had it done by John Barnes, you know, many years ago, the first time, and it was, I mean, I had tears, I remember, streaming down my face. I was also remembering all kinds of crazy stuff, like when I was in the orthodontist as a kid, because I had lots of trauma, you know, mouth trauma from the orthodontic work, and I had oral surgeries and stuff when I was young. And so when I was getting treated, this is when I had migraines, you know, when I was getting treated, I was seeing all that stuff come up like little movies in my mind. It was wild. And at one point, I was actually tasting metal in my mouth, like braces, you know? Oh, I hated having braces when I was a kid. So that's what I would say for clenching. And what I find, here's my theory. I mean, you know, I don't know if this is real or not. It's just from experience. It feels to me like when that total body, like when you start to get a handle on this, total body, like, and remember that one that was, I had the red all over it, you know, when that starts to get less and less and less, I believe there's less clenching at night, because to me, it's like the jaw is off. There's compression everywhere. I remember John saying in the fascial cranium course, And it hit me the way he said it. And I won't say it the way that he did, but I remember him saying, all day long, we're walking around with this compression and this tightness in our body. And I'm picturing the straitjacket, and it's pulling down on everything. And what's at the top? It's your head, and it's compressing down on everything, So I think that's why there's a lot of, and it affects the jaw and the head. I mean, I know that's what I felt like when I was going through all of that. And just even like yesterday, I could feel all of that pulling down. I like to use the analogy of, I know I see in my mind like a duffel bag, like an old fashioned canvas duffel bag, and you're pushing things in there and you trying to get it as tight as you can. And then you cinch the top of it, and way down at the bottom, it's tight as can be, because you're pulling that down. So kind of think of that, flipping that over, that's the head up here. Plus we got gravity pulling down all day. And that just, it takes its toll, So, okay, let's see. Yeah, I don't wear a night guard any longer. Don't even feel like I need one. And really, so what happened in my mouth last year, there was no, everything is different than it was. I mean, my vision is even different. I mean, part of my vision is worse, part of it's better. I feel like my astigmatism is gone. I think from working on all of these cranial bones in my head, but I mean, don't quote me on that. I'm just saying that's what it feels like. So, okay. Did that help? Did that help, Melanie? Yeah. Okay. Do you have them do you have them every day or several times? You can unmute yourself here.
I have them probably, I mean, they started about 6 weeks apart and now they've gotten to a week to 2 weeks apart. And I do take medication for them. But I've been telling everybody it's muscle tension that's causing the migraines, and nobody believes me.
Well, because they can't see it,
Right.
They can't see that. I have a great story. Can't remember if I put this out on a podcast. I do these little blurb short podcasts between long podcasts. And I shared this story from when I had my first clinic. This guy came in. At the time I was taking workers' comp, and he came in with a shoulder injury. And so I evaluated him for the shoulder and asked him, all these questions, health history, and nothing came up about headaches or anything like that. Just we were working on the shoulder. So the first time, gave him some exercise, did, evaluation. Next time he came in, I was able to do some manual work on him, some myofascial release. And I remember spending a really long time on his arm pull, like 20 minutes or more, because he was so tight. And spent a lot of time there, did a long neck release, did some things on his chest, and I didn't need to give him any exercises that particular day. So he came back the next time. And it was so funny. Like I can just, those memories that stay in your mind. He walks through the front door and he's all happy. He's like, oh, he's just like, like he won the lottery or something. We were joking. I'm like, wow, you look happy. He goes, I haven't had a headache since I was here last time. And I said, okay, is that important? I mean, he never said he ever had a headache. He's like, I've had a headache for 5 years.
Oh
I said, you're kidding. What happened 5 years ago? Because, something happened 5 years ago. If you had 5 years, he said, I was in a car accident. There you go.
Oh.
So he had fascial restriction from that accident. And then he proceeded to tell me he'd been to every specialist in the area. He'd even been up to Ann Arbor. He for 5 years, and they gave up on him. And he was on a few medications per day to manage his headache. And he still had a headache. That was the thing. He was still on these drugs, but he still had the headache. And we did an arm pull. We did a long arm pull, and his headache was gone. It never came back. Crazy. Like
Amazing.
I wish everybody was that easy, Not how it is. But, it was just the fact that particular treatment that day helped to take the foot off the garden hose, So cool. So you never know what's going to be the thing, when you think back as to, you've had these for 10 years. I mean, it could be, I was kind of always a headache person. And I think it started, I remember as a kid having headaches. I had horrible headaches when I had braces and went through all of that. And it was just, traumatic for me. And I just needed significant release in those areas. And then adding the self-treatment and the total body work is just, oftentimes too, it can be coming from the pelvis, like I mentioned. Sometimes it's childbirth, or maybe it's scarring from a surgery you had 10 years ago that wasn't bothering you before, but now it is because you've gotten tighter or less active or what have you. I mean, the list goes on what it could be. Have you had treatment?
Myofascial release treatment? No, I just finally found a practitioner in my area. Not covered by insurance, about $150 per visit. So it's I signed up for it, but I'm just hoping that it helps.
Yeah.
It's a pretty significant investment.
For sure, for sure. And if you haven't heard the podcast we just put up last week by a patient, Carolyn, who graciously gave us her story. She talks about that too.
I just listened to that. Yes.
Did you? Great.
Yes,
yeah.
This weekend.
Yeah. So yeah, I have a YouTube video on headaches and TMJ. If you haven't seen that, definitely pull that up. It's not too long to watch.
Okay.
And I'm actually working right now on trying to figure out the scheduling for doing a cranial and intensive coaching type session. So last year I did something similar called Shoulder Essentials, where it was like a 4-week thing. And we actually did some in person. This is going to be all virtual because I can do so much virtual with the head. And put all this stuff together. So we met twice a week on Zoom or in person, and then we were connecting every single day. And you had a buddy. You could have a buddy to help you have accountability and stuff for doing the self-treatment and kind of walking you through those things every day, because it really is something that needs to be done every day. If you really want to focus on something that's bothering you, it's a total body thing, and then really paying attention and then knowing what to do, right? So definitely explore the YouTube channel and then notice what we're doing here. If you haven't done, we're doing the legs up the wall on Monday nights in March, which I had a few people tell me it was really helpful to see me explain kind of what I go through inside my body when I'm doing that, because it's not just, laying there throwing your legs up. It's like really being connected and feeling these tensions in your body. And like Tammy, you're like, you wish you could feel it, it'll come. And, for me, the first time I started to unwind, I didn't even know what that was. I was in legs up the wall and I was really relaxed and I was, doing my thing and just being there. And all of a sudden, my head started to go like this, just real smooth. It started to move. And I'm like, wait a minute, I'm not doing that. Why is it doing that? So John says he'll use the term take your brakes off, So I was definitely had my brakes off and I was letting my body do what it needed to do spontaneously. And it was starting to unwind my neck. And that was actually back when I was having headaches still. So, don't underestimate the power of these other techniques that might not seem like they're treating your head, but they are, especially legs up the wall and the hip strap. I mean, we're getting into all of those, that pelvic base and how that can get all, twisted and torqued. That could be something I could talk about for a whole hour. But how much that's related to the head and neck. And don't give up, because I've helped so many people with headaches. There's another lady that comes to mind a number of years ago. She came to me on 5 prescriptions a day. And she had 2 more that she carried with her in case those didn't do it, because she still was having headaches. I mean, I can't imagine being on that many drugs for a headache. I mean, I know what Maxalt and Imitrex did, and they were by themselves, So sure enough, she had a history of mouth problems like braces. She had some extractions. Everybody's had falls in their life, who hasn't hit their head. She had pregnancies, all of that kind of thing is part of this puzzle. And so we started working with her, and I forget how long it was, but lo and behold, I will never forget the day she came in and she said, I can't believe this. I went out to dinner the other night and I didn't take my medication bag. And I'm like, okay. And she's like, you don't understand. I have been afraid for years to leave home without that bag. I have never left home without that bag in like, I don't know, 10 years or something insane. And she was feeling so good that she forgot to grab her medication bag to go out to dinner. Like, isn't that fantastic? And so by the time we were done, she was not taking any medications anymore. I mean, that's just so amazing, you know? And it's you know, the medical community just doesn't see this stuff. We weren't taught this in anatomy. And when you do all the testing and you don't see anything, and then they send people home with meds because they don't know what else to do, and the meds don't work, like, this is not once in a great while thing. I see this all the time. So yeah, stick with it and keep watching and trying things, and you can always reach out. I'm very accessible. So
I thank you so much for spending the time. I see it too, and it breaks my heart. I'm a nurse, and it kills me to know that, you know, there are other ways to treat this, and you know, people are just coming in and getting medications, and then coming in again and getting more medications to the emergency department. So it's frustrating.
yeah, which is why I'm here doing this right now, because more people just need to know that there's other things to try for sure. So let's see what we got. It's almost 9 o'clock. Does anybody else have any other questions or thoughts or comments?
I have a comment.
Yeah.
I was thinking all this week that I needed to get out my strap and do hip strap stretches. And so there you go.
Yep. Now you know. Okay,
Yeah,
someone
thank you.
asked the YouTube channel. I'm going to ESSTHERAPY is the name. Let me see if I can easily get the YouTube link here. Here. But yes, and if you're familiar with YouTube, if you subscribe to the channel, you have to like put in your email and actually have a YouTube account. It doesn't cost you anything. Then you can follow. And I am going to, here it is. And let me share this. Can I share it? Oh, I know what I can do. Hang on. Copy. Okay, and here I put it in the chat. So it's youtube.com/ and then the @ ESSTHERAPY. So there it is. And my plan this weekend is to do a bunch of videos, you guys. So there should be some new ones up there. If you have any questions, or you want, like, if you want a description of something, you'd like to say, hey, do you have a video on whatever? Let me know that, because I'm making a list and the list is getting longer. So it's time to start doing some of those. But thank you so much for joining me, everyone. This has been so fun. I could talk about fascia forever, every day, and share. So if you have any questions or need help, reach out.
Thank you.
You're welcome. And then next Monday, Legs Up the Wall is at 8:30 Eastern time. And then you can also watch the replay. So it's all out there. Have a good night, everyone.
Thank you. Bye.
Thank you.